Some of the top New Year's resolutions every year are around losing weight, eating healthier, quitting smoking, drinking less alcohol. Here in San Francisco, where I work, maybe using less cannabis. But do you know that surgery can actually help you stick to these New Year's resolutions for longer? And I'm going to share with you three specific tips that you can use whether you're having surgery or other similar situations that you might find yourself in to be able to make the most of New Year's resolutions using the same core concepts. And if you're wondering if it's surgery itself, it's not the surgery, it's what happens to your brain and the rest of your body when you're in an operating room like the one I'm in right now. I'm Dr. Anthony Kaveh, a Stanford and Harvard-trained anesthesiologist, and every other week I have a patient who comes in, even if it's not New Year's, with a really clear goal for what they want out of surgery. And after seeing hundreds of patients like this and following them for months after surgery, I wanted to share the observations that I've made so that you can emulate their success no matter what resolution you're trying to stick to in the new year. And you're going to recognize that it's really hard to miss this in most patients. So please, if you're a health professional out there and you want to learn about this, recognize that you need to talk to your patient first to figure out what are the core elements that help someone be successful taking their New Year's resolution out for months and months after a time of surgery. It's because you need to put aside the fears and anxieties that patients are saturated with. If you can speak with a patient long enough before surgery, you'll find that most patients specifically want something, often related to their surgery, of course. Whether it's a better cosmetic result, maybe it's better functionality from their hip or shoulder or knee surgery. Maybe it is pain relief. It's one of the most common ones, relief from chronic pain. Think back pain, neck pain, shoulder pain, etc. Maybe it's better reproductive health if that's what they're coming for, or a lifestyle improvement if it's a bariatric surgery for weight loss. Of course, there are some patients that have a medical necessity or an emergency or a reconstructive surgery. But regardless, every patient wants something. And the key is to recognize that wanting something is common amongst all humans, like you and me. But before surgery, you want something, and there might be a lot of fear and vulnerability. And you have to give up a tremendous amount of control. Because when you're under anesthesia, you're in a medical coma. You're trusting your anesthesiologist, your surgeon, the nurse, everyone else in this operating room to keep you alive. It's different than just wanting something. It's wanting something and being in a highly vulnerable environment where you have tremendous trust and you have the medications that go into your body, like out of the ventilator behind me. This is key because those medications foster a transformative consciousness that can grease the wheels for sustained healing. So if this sounds like taking a big plunge into something, you got to trust a human you may have never met before with your body and your consciousness. You're going to have your body cut open on top of that, etc. You're right. And if not used properly, these types of overwhelming experiences can be detrimental. They can lead to worse depression, like postoperative depression, postoperative cognitive deficits, anxiety that's worse, PTSD. But if you use the three tricks I'm going to share with you, you can hopefully transform this experience to not only heal your body, but also to heal your mind, to discover better self-efficacy and ultimately self-mastery by discovering your inner strength and to be able to advocate for yourself moving forward. So if this sounds too good to be true, you're right. In many cases, if someone doesn't have the right mindset, it's not going to happen. But some very clear examples are look at women that give birth, or I guess people of childbearing capacity who give birth. Putting pronouns aside, the point is that it's a painful experience, but it's a life-changing one. How about an athlete who puts their body through tremendous stress? Maybe they get sick, they have injuries, but when they come out victorious, there's a transformational experience that they've gone through. Look at someone who's got a spiritual experience, not too different from what we're going to talk about right now. Because these three tips are important no matter where you're trying to make a lifelong change, surgery or outside the operating room. And just as a quick Reminder, a quick plug before I give you those 3 tips. If you could hit that like button if you're learning something new and share with others what you've learned to help empower them to advocate for themselves in our broken healthcare system, it would mean a lot. So that you can always remember that you have more power over your health than you've ever been told. So number 1 is that obviously your goal has to be realistic, and it has to be aligned with the surgery or the overall experience you're going through. For example, if a woman is having a mastectomy, or a man for that matter, for breast cancer, well, alcohol use is absolutely a risk factor for breast cancer. If you can align cutting back on alcohol with that surgery, it will allow for a synergy that we'll talk about in a second. How about someone coming in for a hip replacement from hip osteoarthritis? Typically, being overweight can predispose to premature hip osteoarthritis. There's a synergy there if you can align, for example, healthy eating, more physical activity, weight loss, etc., with that surgery. How about hemorrhoids? Very, very common to have these, especially in the Western world. Typically a result of bad pooping habits, like being on your phone while sitting on the toilet, or a low fiber diet. Once again, you can address lifestyle activities in your diet and also have that be aligned with the surgery that you're having. Frozen joints and anxiety, ENT or throat surgeries, and smoking, there's such a long list of them. But the more alignment you have, of course, you're going to start off better. Number 2 is the intention that you have. And this is so powerful, especially for my patients that come to me for ketamine as well, because that intention before they start their ketamine journey, which is anesthetic as well, by the way, is very guiding and powerful for where the experience takes them. Same with surgery. Same, by the way, before you go to sleep. The altered state of consciousness that we call REM sleep, or your dreaming state, is also, as you know, dependent on what is in your mind before you go to sleep. If your intention before you go to sleep is one of restoration, peace, calmness, tranquility, you're probably more likely to engage in that in your dreams and wake up more restored. But if you go to sleep angry or frustrated or cold or otherwise preoccupied, you can imagine waking up maybe with a nightmare or waking up not feeling as restored. It goes to show how important that seed is before you enter an altered state of consciousness, the general anesthesia, or something else. Typically, as Pasteur said, chance favors the prepared mind. So if you are already set in the right intention, you're going to optimize your chances of being able to take that experience of vulnerability, trust, and the anesthesia itself, quite frankly, to have a lifelong change in your self-representation, your ability to pull through with what you want to do, which, as you know, is often torpedoed when we have negative self-thoughts, when we are not confident in ourselves, when we have other fears, doubts, or uncertainties about ourselves or what we want to accomplish. If we want to turn that upside down and use our self-efficacy and self-actualization to have a long-term change, this is a time that you can do it, provided you have that right mindset going in to that vulnerable moment. And number 3 is to use your care team around you, your doctors. Discuss what your intention is with them, with the nurses, with any friends or family members or other loved ones. The more that your surrounding is supportive of your intention, whether it's quitting smoking, cutting back on cannabis, exercising more, being more social, having more friends, whatever it might be, as silly as it might sound, the more people around you who are supporting you in doing that, when you are vulnerable, when you are not confident in your ability to do that, plays a powerful role in helping build your confidence to accomplish that. And this is why when patients come to me specifically for ketamine, I want to make sure that all of their doctors and the rest of their loved ones are on board with their care plan to get ketamine, for example. Because if anyone is not, you can imagine that might be a little torpedo that could take over their efforts for such powerful healing and personal growth. So number 1 was the realistic intentions that are aligned with the surgery whenever possible. 2 is to have that intention, like we talked about. And number 3 is to make sure that everyone around you is aware, especially those in power above you, whether it's I'm not saying it's good to have power differentials per se, but realistically, you may have parents, you may have a doctor, you have someone who's got a power differential. If those in power are supportive of you, I find there's a powerful uplifting effect with the patients that I've treated over the last 10 years. And just one more word for intention, so you know, intentions are most powerful when there is no right or wrong answer. Specifically, the more constrictive your intention is, and I tell this to all my patients before they get ketamine or before they go under anesthesia, the more constrictive and prescriptive your intention is, perhaps the greater the chance of failure. And when we fail, we know that self-disappointment, shame, feeling like we're not worthy can blossom. And that's what so many people have after New Year's resolutions fail, because they have such a, I need to lose 20 pounds. It's like, what, if you lose 19, you're a failure, right? When we are in a vulnerable mindset, we become rigid. The more fluid your intention is, the more likely it is to be lasting and not to lead to negative self-thought, self-disparaging comments, and ultimately losing our self-efficacy and confidence in our abilities. So for example, just so you know what I tell my patients often for their first ketamine infusion, because of all the similarities between surgery and ketamine that we're talking about, open heart, open mind. Now, of course, that intention, open heart, open mind, is not applicable to all types of New Year's resolutions, but I want you to appreciate how that intention can't really go wrong compared to something that's finite and dependent on a rigid result. You can control open-heartedness and open-mindedness. You might not be able to control how popular you are, how much money you're going to make next year, exactly how many pounds you're going to lose. But you can control things like your integrity, your honesty, your open-mindedness, your ability to forgive yourself and be self-compassionate. It's not always easy, but at least you have the potential to be in control. I hope that you learned something new. We're going to answer your questions now. If you did learn something new, please hit that like button and share with others. And if you do have New Year's resolutions, with or without surgery, I hope that you can take some of these elements away so that you have the maximal chance of achieving your New Year's resolutions in the coming year. Linda, Heidi, sleep deprivation before surgery, how does it affect you? I typically find that most patients who are sleep deprived don't need as much anesthesia, especially for emergency surgeries in the middle of the night. Stacy says, we all have something, whether visible or not. Deprive someone of hope, it may be all they have. Yes, Stacy, hope is incredibly powerful, and sometimes it is all we can give someone. But fortunately, hope in and of itself sometimes can be enough to catalyze powerful transformations. Sarah, what happens if I don't tell the doctors I use street fentanyl before surgery? Well, there is a concern, like you said, for the withdrawals, because if you don't get the amount that you need, you could go into a withdrawal. Number two is that you might not get enough pain medication because of the tolerance that your body has built. Good question. I have surgery tomorrow, says True Help TV, and I was contemplating sleeping before surgery. Well, you certainly can. I'm wishing you the best for your surgery tomorrow. Matt says, hold yourself to a higher standard than others, but not impossible standards either. Very, very well said. Let's answer two more questions. Anesthesiologist supported me, fought for me against an ego surgeon. He went in and strongly talked to the surgeon before surgery. Wow, what an experience. I hope that you recognize just how important having those deep discussions with your doctors are, so they understand what you want, so that they can advocate for you. Very powerful story. Thank you for sharing. Midazolam death count. Not a question there, is it? CyberDoc says, perhaps intent and the subconscious mind are the most powerful forces in the known universe. That's a very fascinating point. I am inclined to think so. I will say that there is no one else in the known universe, CyberDoc, no one else in the cosmos who has the ability to heal you as much as you. No one else has the ability to forgive yourself, to be self-compassionate as much as you. Yes, doctors can provide life-saving services, no question. So they have incredible power for that, but they can't help you open the door to self-compassion. Only you can. And I don't mean this in a trophy, everyone gets a trophy, everyone's a special snowflake. No, I mean that you have a sacred potential to be self-compassionate and give yourself the respect and dignity that you need to achieve a sustainable healing that no one else can do for you. I'm not saying it's easy. I'm not saying it's your fault if you have not accomplished that, but I'm saying that if you can foster that self-deservingness to heal, it is incredibly powerful, and no one else in the known universe can do that for you but you. So I agree with you, CyberDoc. Last question. The last question, can ketamine be used through a pain pump, Stacy? I've never actually heard of it used that way. Usually we don't provide ketamine intrathecally or around the spinal cord. It's usually given IV for pain. Very good question. And maybe one last question here. M. Henderson, if you have uncontrolled high blood pressure going into surgery, what happens? Well, it depends on how high it is and why it's high. We don't want to artificially lower high blood pressure. We want to address the root cause. We also need to make sure that the blood pressure is safe for the type of surgery that you're planning to have and given the rest of your medical conditions. CyberDoc, you are very welcome. Awake late night pondering the self-compassion aspect. Yeah, CyberDoc. Well, thank you for what you shared. And Ginger Snap, I appreciate your kind comments. I thank you so much, everyone. Remember that you have more power over your health than you've probably ever been told. If you have a New Year's resolution, use these 3 strategies, whether it's surgery or not, that you find yourself in, to make the most of them and maximize your chances of finding that inner healing potential that has no side effects and is really difficult to overdose on. Until next year, take care.